Thank you again for joining the Telehealth Educational Series. This is our Q&A session that hopefully is going to help everybody. We want to let you know that we hope that you enjoy our presentation today, and we're going to want you to ask as many questions as possible during the time frame allowed. We do want to have you guys give us a little bit of information though when you're asking your questions to make sure that we answer them appropriately. So some of the information that we would like to know is your state and the practice setting. And for example, we do have 2 examples listed. So South Carolina and private practice, for example, that will definitely help us be able to answer your questions. During the session, it would be great if you could utilize three different tools to ask us questions, and in order to ensure that we help get through everyone's questions, what we'll do is we'll go ahead and we'll manage them through these 3 cues, and if time allows at the end, we will open the end of the session up for verbal questions as well. So those 3 methods are using the Q&A at the bottom of the screen. Please feel free to raise your hand, and then also you can send a question via chat. So this live Q&A session was designed to answer questions that emerged from the 6 on-demand telehealth educational sessions. If you haven't had a chance to review those, we highly recommend it. You'll find many answers to your questions in these sessions. We're also recording this session today, and we will be emailing and posting the recording of the Q&A session in the playlist. If you'd like to listen to the live Q&A session or revisit the other 6 on-demand sessions, you can access that playlist at this URL, which again, I have posted in the chat window just in case you need to copy and paste it. Oops. Sorry, I got a little ahead of myself there. I'd like to welcome our 2 presenters today. We have Robbie Leonard and Jen Gamboa. Robbie is one of our resident faculty for Rehab Essentials. She's our resident expert on telehealth, Medicare, billing and coding, and compliance. And then Jen is our COO of Rehab Essentials, plus she is our population health and wellness expert. So good morning, Jen and Robbie. And with that, I'm actually going to let you guys go ahead and get started and let you guys introduce yourselves a little bit further.
Good morning, everybody, or afternoon, whatever time it is in your neck of the woods. Glad you're joining us today, and hopefully we'll be able to answer questions that you have about implementing telehealth program in your practice. Obviously, since the COVID-19 pandemic, we've all kind of been moved up in our timeline of implementing new technology. So we're here to answer your questions, and glad you're joining us.
Oh, I guess that's my cue. Sorry. Yes, I'm glad that we're able to be on the phone and to answer questions. I'm probably more of the practical application side of this. In addition to working with Rehab Essentials, I have for many, many years owned an outpatient private practice in Virginia, and we have a team of about 30 practitioners who are all very rapidly transitioning into telehealth and virtual PT. So my goal here is to just kind of help answer practical and tactical questions. So welcome everyone. We look forward to hearing your questions.
Perfect, thank you both. We do have 2 questions that are already in the queue. The first actually is, what lessons have you learned as, sorry, let me read this again, I apologize. I'm getting started this morning, everybody. So when you look at telehealth, both as a PT and as a patient, having done the videos, can you tell us a little bit about your experience as the PT and as a patient? Jen, why don't you take that first, talking about the experience as the PT?
Sure. I think that what makes a good session is really good preparation. We always have to prep for our evaluations and our follow-up visits, but it's even more important in a virtual environment. So what we do is we send out an email ahead of time that is very detailed in terms of what to expect and how the session is going to run, and to set up to make sure that they've downloaded the video. We use Zoom to make sure you've downloaded Zoom ahead of time, and kind of talk about how to set up your computer and those sorts of things. And then for me, it's making sure that I've really, done a thorough read of the intake ahead of time so that I can kind of plan out the evaluation more precisely. Because I have to be aware of how many times I'm going to ask the patient to move or to change the visuals on the computer or change the angle of the computer. And so trying to plan it out not only for an efficient sequence for data collection, but also an efficient sequence for the patient moving around their home environment.
And I would, from the patient perspective, so hopefully you've had an opportunity to watch some of those videos, even if you didn't watch them in real time, maybe watch them and fast forward. But to watch that interaction, I was somewhat skeptical that Dr. Gamboa could treat my neck and not put her hands on me. But she's very efficient. She's very effective. She gives really good cues. She's very directive in what she wants the patient to do. And so I think that's really critical that you communicate well, that you're talking to the patient even when the patient can't look at you because they got their head down because they're doing something. And I was pleasantly surprised at how much we could accomplish in a short amount of time and how much direction I could be given, even with manual skills, in working through that telehealth session. So I think from a patient perspective, if you have patients that are, skeptical, or maybe they're concerned, or maybe they're worried, I would have in my script of converting patients from in clinic to telehealth to, let's try a session, let's see how it goes. And I think the therapist, like Jen said, needs to be very prepared and organized, but also needs to have confidence and needs to smile, and we need to have a little fun, and we need to laugh. And you develop that rapport just like you would with the patient in the clinic. So I think those are some critical factors.
Wonderful. And we have two questions that just came in. They are related. So I'll ask you them both, and I can always come back if you need me to ask the second half again. But the question is, you use Zoom for your evaluation and treatment. How did you cut and paste the documentation and HEP into your EMR? Subsequently, the following question asks, how did you email the HEP securely? Encryption program for your email?
Okay, so the Zoom platform is just how I see and how I interact with the patient, but all of my documentation went directly into our EMR. And so we exchanged the home program and all of those things via the portal. So the patient, I would shoot an email to Dr. Leonard and say, hey, you've got things in your portal. And then I did also, we were very descriptive in what the home exercise programs were, but I also sent video links from a secure Dropbox and gave her the links to just the exercises.
Yeah, and I would say that, from a documentation perspective, you're going to use your regular EMR. You're going to document that you did a telehealth session and why it was telehealth, not in the office. You document just like you would a regular note, all the pieces and parts, just like you would. And then as far as the interaction, Dr. Gamboa's system is secure. She has a secure portal. So the patient just clicks on the link to go to their information on the portal. If you don't have that, a lot of our EMR systems have ways that you can communicate securely with your patient. So if you have a WebPT or an Optimus or an Epic or whatever you're using, you want to check with your EMR system to see if it has a mechanism for you to communicate with your patient securely. And then if you do not, then you definitely want to, if you're going to email, have a secure email mechanism. PAUBOX, PAUBOX, is one of the encrypted technologies that a lot of clinics use for encrypting email. But there's a multitude of different ways and systems, HIPAA compliant systems that you can utilize for those kinds of things.
Perfect. And along those lines, we have a question that specifically asks, do you need a VPN?
No. So, when you look at the telehealth webinar, the first one that's listed on the list, we talk about choosing your system that you're going to use. And so when you are choosing your system that you're going to do telehealth in or on, then you're going to look for the capabilities of that system that will work with the broadest range of devices and with the broadest number of browsers, for example. So, I would choose a telehealth platform that allows me to communicate with just a click of the button to connect. And it would be useful on Chrome, Safari, Firefox, all of the browsers, and iPads and iPhones and Android devices and Microsoft devices and Apple devices, so that you can communicate with the patient regardless of what device or browser they're using.
Thank you both. We also have two questions from two different participants, and I'm gonna just read them both to you because I feel like they tie together. But this one is specifically about patients who may not be so tech savvy. So the first is, some patients are not tech savvy. Is this okay for all generations, especially for the baby boomers or veterans? Can the families assist them with this? And secondarily, the other question actually asks, is there an easy way to access tech support from your end or from Zoom's end for those who are not tech savvy?
I'll take a stab, and then I'm guessing that Dr. Leonard will have additional info. I don't think that all patients are appropriate for telehealth. I think that, are they going to be safe in doing an evaluation in the home by themselves? Are they a fall risk? Are they some of those other things that may make somebody vulnerable? But in addition, can they log into the technology? Can they access that? I think it's very appropriate to have a conversation with a patient who is interested and but maybe needs help getting online, and if they can sort through getting the help from their end to get online, then it certainly makes it appropriate. We have some patients that we're going to want another standby assist there anyway, because we're concerned about balance or falls issues. So I think Zoom, certainly my experience would be that they are not the ones that are going to provide the technical help. That's just not what they're designed to do. But I know that many of our clinicians have done dry runs. So, hey, your appointment is tomorrow, but I'd love to do a dry run with you today just to see how, just to make sure that the setup is working out well. So, it's a 5-minute quick, let's link up, say hello. Oh, you got it. Perfect. Where are you going to put it in the room? All right, that's great. So that's how we've solved for those things. And I'll just pass on one other thing. One of my clients is the executive director of a senior daycare center. And of course, they are no longer seeing one another in person. And so they're also conducting their sessions via Zoom. And I just mentioned this because that age bracket is definitely not tech savvy, but they typically have a caregiver that can help them get online. And then they're so happy to be online, so happy to just connect with one another. So hopefully that answers some of those questions.
Yeah, and I would say that this whole COVID pandemic has made more people more tech savvy than they ever thought they would.
That's right.
Because, families are having dinner via Zoom and interacting. And so I wouldn't just make an assumption. And so ask questions and, see if they have somebody in the house that can help them do the dry run. Some of the platforms that you choose, so, we don't say Zoom's the only one to use. There's a multitude of platforms out there.
Right.
And some platforms have more bells and whistles than others. So, if your population is less tech savvy, then choose a platform that's going to be the easiest for those folks to use. But I will say, in today's world, even my 87-year-old father-in-law uses the internet to check his bank account every day. So, I would not rule anything out in today's world with the technology. So.
Perfect. And then along with those lines, the second half of that question was, what do you do with the clinician who maybe not be so tech savvy?
That's a different problem. I think some of the keys are, and there's certainly some nervousness to using technology, right? And how am I going to do this? And how am I going to set this up? So in our telehealth webinar, we talk about making sure that your therapists get proper training. It's not like seeing the patient in the clinic, that they have tools that they can use, that they know how to use them, that they have appropriate education. Just like you're learning a new manual skill, you need to learn how to do it appropriately. Then practice, so practice with your coworkers, practice with your family that'll let you treat them. But do some practice sessions, get comfortable, because we're not all comfortable. Like just making eye contact with the computer, right? I've learned to look at the camera, but I really want to look over here where I see all your faces. So I think it's important that we learn those skills as we're learning to use the systems.
Yeah, and I would say that from a practical standpoint, we had a lot of dialogue amongst our staff about standardizing our approach so that we could train one another on it. We agreed upon standardized tests and measures that we were going to use, at least as a baseline. We did a lot of research. We had a team of our PTs focused on making sure that we had all of our I's dotted and T's crossed. And then we did start practice runs. That's exactly what we did. Practice with each other, and then people just kind of dove in, and they were really frank and honest with their patients. Hey, the technology may be a little squirrely, we're all going to take a breath, we're going to take our time, and we'll get it done. So I think it's they're very comfortable with just kind of helping to frame what the technical glitches might be during a visit, and then just diving in. And I think that every one of our therapists have been extraordinarily surprised once they've done their first or second session, how much value there is in those sessions, how much they can see, how much they can understand. And there's some really nice literature coming out now looking at the efficacy of virtual PT versus in-person PT. And there's some really nice outcomes coming out being published. So.
Thank you both. We've had a couple different attendees join, so I just wanted to remind everybody, if you have any questions, please feel free to either ask them via our Q&A, via chat, or by raising your hand. We will answer all of these questions, and just in case you do have to leave due to, I don't know, a patient needing care, please feel free to do so. We'll be recording this conversation, and we will be posting it in the playlist. So with that being said, the next question I have is, I would like to know how to choose patients for telehealth session. What is the criteria for choosing? We cannot see all the patients for telehealth, as there'll be a severity of conditions and a variety of complexities.
Are you pointing? Are you handing to me? Yeah. So my response is say, start with yes, I can see this person, and then start to, sort of define the specific things that you would be concerned about. I think almost every patient is appropriate from the perspective of they need exercise, they need fitness, they need to be able to move without pain. And if we can help that, then we should. I've had several patients who have meniscus tears, and we know they've got meniscus tears, and they're in extraordinary pain. Okay, so what do we do to back them off their exercise, get the right exercises in so they can, sort and recover and then keep moving. So I think that I always start with, of course. And now let me ask some questions, right? So if I think somebody if they can't get online, that's going to be a problem. And maybe it's a phone call ahead of time to say, just making sure that you can link up with our video platform. If I am concerned about fragility, are they a fall risk? Am I concerned that they're not, that they're going to injure themselves, then they might not be a candidate. Or what I more likely would do would say, hey, do you have somebody at the house with you that can help us get this done together? And the other piece is if they're not in a position to follow verbal commands. I mean, if they can't follow verbal commands, or they don't have sufficient mobility and they don't have a caregiver who can help, then they may not be appropriate.
Wonderful. Thank you. The next question we have in the queue is, does Medicare cover telehealth visits or e-visit?
That's you.
Well, yeah. All right, so let me get you up to speed on what's happening at the moment, and tomorrow my answer might be different. So Medicare currently covers e-visits, phone visits, and virtual visits. They did say this week in a session that those only apply for clinics who bill on a HCFA 1500 form. So that is not hospitals and rehab agencies at the moment. They also did verify that phone visits and e-visits and virtual visits need to be done by the clinician, which in Medicare language is a PTOT speech therapist and not an assistant. That is how it stands today. The problem with telehealth and Medicare is that even though when they came out with a ruling on March the 30th that added physical therapy, occupational therapy, and speech language pathology CPT codes into the telehealth language, they did not place professionals, PTs, OTs, and speech therapists into the list of professionals who could provide telehealth services under the Medicare statute. You're probably well aware, huge advocacy effort to try to get CMS just in an emergency waiver to put PTOT and speech therapists into a emergency provision that would allow therapists to provide telehealth to Medicare recipients, to Medicare beneficiaries during this emergency timeframe. There is still hope. We are still hopeful that that will happen. I'm hopeful that that will happen in the next few days. But again, as it stands today, telehealth is not a covered service provided by a therapist. We are hopeful that will change. So stay tuned, keep an eye on the APTA website. If that happens, it'll be blasting that to the world. But that answer may change over time. But right now, as it stands today, for Medicare, you can perform an e-visit, a phone visit, or a virtual visit if you are billing on a HCFA 1500 form, which would be a therapist in private practice or physician-owned clinic. So that's what we got for today. If you are treating Medicare Advantage plan patients, so your patient has Medicare Blue Cross, for example, you need to check specifically with that plan, because Medicare Advantage plans can add in services that Medicare doesn't traditionally cover. And we have found that some of the Medicare Advantage plans are allowing for true telehealth services because they're covering it for their other commercial products like regular Blue Cross. So for Medicare Advantage, you'll need to check specifically with that payer.
That actually, I believe answered the very next question that I was going to ask. So we might come back to that one here in just a couple of seconds once I double check with the participant to make sure we've answered his question. The next one would be the frequency and duration of visits. What has been typical or expected similar to in-person visits?
So when our staff was planning, kind of laying out a framework for virtual visits, there was the expectation that the visits would be short. They would be shorter. So there was this thought that, your evaluation might still be an hour, but the follow-ups would certainly be 30 minutes or less. And that, Robbie and I did not find that. I find that most of my if my follow-up visit was going to be an hour, it's going to be an hour online as well. If it was going to be a shorter visit, because we were more updating home exercise program or checking in on symptoms and modifying functional activities, then it might be a shorter. So I've had a wide variety. The evals are typically an hour. And I would say bell to bell, because you have to leave time for, making adjustments in the screens and where the patient is positioned so that you can see what you need to see. But again, the follow-up visit, you're starting with a reassessment, and then you're honing in, and then you're hopefully progressing their program. You do it takes the time that it takes for an in-person visit. You would do the same for a virtual visit.
Yeah, and I would suggest that as your therapist are kind of learning and getting comfortable, it might take a little longer for the first few that you do. So I would schedule plenty of time for the first ones until people kind of get in the groove and get more comfortable. But yeah, I would, if you typically would schedule an hour for that visit in the clinic, I certainly wouldn't schedule less time.
Perfect. Thank you. So the next question is another technical question of sorts, but sometimes I use music and it doesn't come through well. Any suggestions? This was both on Zoom and on the Terra platform.
Can you repeat that, Cheryl? I missed the first part of that.
Absolutely. It said, sometimes I use music and it doesn't come through well. Any suggestions? This was both on Zoom and on the Terra platform.
So I would say that it is important, and we cover this in the telehealth session, to look at your equipment needs. So I give an example of, I used to have a laptop that had just a horrendous microphone that liked to squeal. So if you are going to do a lot of telehealth, you might want to purchase a nice little microphone, like a professional version that's a little more expensive, that gives you better sound. So those are the kinds of things that you want to test out with somebody first. Dr. Gamboa, I actually use my iPad as the patient because I can move it around everywhere. I didn't have any issues hearing her, and I don't think she had any issues hearing me. But definitely you want to, as the professional, make sure that your sound is really good, your camera is good, that you've got space to move and demonstrate, and so that you set up your environment to be professional with your visit.
And I would say, I think I can only speak to Zoom, which is what we're using. There is a share function. So when you share your screen, you can share just sound only. And when you do that, if you're playing music from your computer, your participants will be able to hear the music. So we have Spotify loaded in, and if we want to play music, we can do that. Where we're really experiencing that is with our fitness classes. But we find that when we play the music, that it interferes with the microphone. So we just tell people to play their own music because the microphone and the verbal cues are more important.
Thank you very much.
Mm-hmm.
So going back to something that had been mentioned, it was mentioned that it can be cash-based. How much is the usual charged?
So I'll address that one. If your payers aren't covering it, or if you're providing the service to Medicare patients at the moment and it's not covered, you want to set your price, and no one can tell you what that should be. But you need, as a clinician, business owner, whatever your setting is, to know what your resource use is and what the value of that is. And so, in my opinion, my telehealth session would be no different cost than my in-clinic session. It's the same clinical judgment. It's the same therapist providing the service. You've got to provide the equipment, and you've got to provide the clinical judgment. You've got to document. And so, in my opinion, I would not sell the value of a telehealth session short.
I would agree 100%. In fact, we've had this conversation. So I happen to be a fully cash-based practice. So that is probably why we were able to move more rapidly into the telehealth arena. But we had that conversation amongst our staff, and what I'm offering is not as valuable. And I thought, well, if the comment that I made was, if PT is just your hands and not your head, then perhaps you're right. But I think that PT is much more about our heads and our problem solving skills than it is our hands. And I'm a manually trained therapist. So I'm not knocking our manual skills, but at the end of the day, it is our critical thinking and our problem solving, and that is of value. So I would concur that we should not undersell it.
Wonderful. Thank you both. Next, we have a question that is specific to pediatric standardized testing. So in regards to pediatric standardized testing, is it appropriate to administer the test and simply indicate it cannot be considered standardized due to implementation via telehealth?
I'm not sure what standardized testing you're talking about, but I can certainly say that when we're doing the SFMA or we're doing our orthopedic exam, I mean, I've had my patients do their own special tests, and I just document that it's patient guided, that it's a patient guided special test. And you should be documenting that it's a virtual session anyway, so it becomes somewhat self-evident that the data was collected via telehealth.
Or with the help of a parent or whatever.
Right.
Perfect, thank you. So the next question is, I read that some of the insurance covers for telehealth sessions. Can I get more information regarding insurance, as most of the patients ask me how the insurance works? How do they pay for the services versus the insurance?
So I have given you some links on those sessions. Your best reference point, and the APTA is, dealing with this issue every single day. They're advocating, they're talking to Medicare, they're talking to insurance payers every day. I actually serve on the APTA private practice sections COVID-19 work group. We have met every single day for the last forever and working through some of the stuff. So your best reference point for getting what insurance is doing in your state, and it's going to be very specific to where you are, is go to www.apta.org and then /telehealth. And that reference is on the handout there or at the end of the telehealth session. You will go to their website. You will look at, in the middle of that page, they have private insurances, state-specific mandates. They have commercial payers, what all the different payers are doing in regards to telehealth during the pandemic. Then you will click on the link that's provided. For example, you will go to Cigna's link, click on the link, and then you scroll down to where they address physical occupational therapy, and it will give you specifics like what codes they're allowing, what modifiers are needed, if the patient's copays, co-insurance deductibles apply, or if they're being waived during this emergency time frame. So that's going to be unique to the payer. In addition, on that telehealth webinar, I also gave you a list of insurance verification questions that should be asked. So that's no different than providing your in-house visits. You want your insurance folks to be calling and asking those questions. Do you cover telehealth? If so, do you pay for the regular CPT codes? Are there any special verification things that we have to do? Are there limits on visits? So there's a list of questions, if you look back at that session, of things that your insurance verification team should be asking specific to telehealth.
So I'm going to go ahead and Jen, it looks like you had asked to maybe be unmuted. You should hopefully be working.
I am now.
Perfect. Sorry.
No problem.
Sure there with the technology. Just want to double check. It'd be probably important for the next group of questions. So, and again, this is slightly different, but for this type of service, is there any difference in the reimbursement rate?
And so again, that's going to be very specific to your payers in your area. Most of our payers right now during the emergency time frame, if they are covering telehealth, they are covering telehealth at the regular in-office rates during the pandemic. Don't expect that to continue when the pandemic is over. I think, we'll have an opportunity to advocate for this methodology of delivering care but most of these regulations are put forth for the emergency timeframe. So you're going to want to go look at that website that I gave you, click on the links, look specifically at the payers, and get the information straight from the payer.
Thank you. So the next one is actually more about functionality with patients. Have you created a cheat sheet for the patient within the intro email and prep for the Zoom session?
Yes. It's a standardized email that we all send out that everybody receives if they're having a virtual session.
Yeah, and it provided instructions on, what to wear, how to be prepared, how to click on the link, all that sort of stuff. So you want to give your patients good direction on what to expect and how to connect and what kind of clothes they need to be wearing and where they need to put their camera and they need space to move and those sorts of things. So they have that direction.
And I believe we posted the sample of the email in the webinar series. So if you want sample language, you'll see it there.
Perfect. Again, just as a reminder for those of us who joined us late, please look at the top of the chat window and you'll find the URL that will take you into the sessions that we keep referencing. They're all part of the telehealth series. So please feel free to take a look at those. The next question is, are new PT evaluations allowed via telehealth or is it limited to existing patients only?
So two things you need to check. One is you need to check your state practice act. And that should be your first step regardless of what you're doing to make sure that you're covered for telehealth and determine if there's anything specific to your state that you need to be aware of or any caveats of what you have to do to provide telehealth in your state. So that's step number one. Step number two, back to that insurance piece, is you're going to want to look at that insurance specific information. So for example, with the e-visits, which are not really telehealth, the e-visits, the phone visits for Medicare, those specifically state that they have to be established patients and the patient has to initiate those. So there are very specific rules for those for Medicare. For your commercial payers, you may find, for example, I believe it's TRICARE that says that telehealth is covered for an established patient, meaning that you've seen the patient in the office first. Other payers, like Blue Cross of South Carolina, has opened the door for all visits to be done through telehealth, including evaluations. So you're going to need to look specifically at the payer, look at their rules, and look to see if they're covering the initial eval piece. But check your state practice act first for any telehealth restrictions on who can provide telehealth services and any specific things that you need to do to be legal in your state.
Thank you. So the next question actually comes from someone who has a pediatric outpatient setting in rural Georgia. And the question is there a time limit on telehealth sessions? My clinic has focused on 30-minute sessions, but this is challenging with the lower level CP kids, which require a significant amount of cues and extra time is needed for flexibility and muscle facilitation techniques warm up to get functional active participation of the child. And again, it's an outpatient pediatric setting in rural Georgia.
I think those are maybe where there are two different issues that are coming together. I mean, I think both Dr. Leonard and I said that you need to take the time to take to do a proper session, and in fact, it may take a little bit longer virtually versus in person. I think perhaps the underlying question is, then what can you bill for? What time can you bill for? And Dr. Leonard, you probably have a better sense of that than I do.
Some of your Medicaid, and I would assume most of your kids being treated are under the Medicaid program in Georgia. And so Georgia Medicaid has some interesting things, like they have their own specific telehealth consent form. But you'll want to look at what your payer restrictions are. So if your payer is restricting you to 30 minutes, then that may be what you're left with, depending on your facility and what your policies and processes are. So again, clinically, we believe that you should do what it takes to treat the patient. From a payer perspective, there may be some limitations on the amount of time you can spend or the number of units that you can bill. So you may have to marry those up, and maybe you'd be allowed to do more frequent sessions during the week than you would normally do to get the amount of treatment in that you need to get in.
Thank you. The next question is specific to the session on e-visits. I watched the session on e-visit and it is billed different than the telehealth, but it still uses audio and visual, right? Otherwise, it would just be a phone call.
So no, e-visits are by definition done through a secure patient portal. So my best example of a secure patient portal is, for those of you who are familiar with like Epic and MyChart, I can go into MyChart. So if I'm the patient, I can go into MyChart, I can log in, I can send my provider a message, and I can say, hey, I'm having trouble with this particular exercise or this part of my program. Can you give me some direction? And then the provider answers me back. That would be an e-visit through a patient portal. A phone visit would be obviously on the telephone. Now, Medicare has said they're going to be a little more broad in their interpretation of a patient portal, et cetera. So, you know, how broad, they didn't say. So, but by definition, an e-visit is through a secure patient portal, and by definition, a phone visit is on the phone.
So, Dr. Leonard, if a practice was using Pawbox to encrypt email, for example, then that could be considered an e-visit.
It could be part of a virtual visit, yeah. So, and again, those are some pretty gray zones right now that the association and others are trying to get better answers to. But that's what we know today. So stay tuned on that, because that seems to be evolving.
Thank you. Next question is, I have a couple of patients here in the outpatient setting who I started seeing in person for initial evaluation. I was wondering what to do with special tests and muscle tests using telehealth for re-evaluation. Should I just skip those tests?
Well, to the extent that you can have the patient perform the special test, then you should have the patient perform the special test, or a caregiver or somebody who's living with them can perform the special test. I mean, when the session starts virtually, you choose your special tests wisely. So if you're looking for a meniscal derangement, you're using a facility, and they can do that independently of you anyway. You can do overpressures you can have a patient do overpressure to knees and ankles and to themselves. So to the extent that you can reproduce a special test, you're trying to. To the extent that it's just not possible, manual muscle testing is really difficult. So you'll see that what we're trying to do instead is get a general sense of functional capacity. Whether that's general fitness, or if it's, looking at how many push-ups somebody can do, you're trying to get a general sense, and then you're basing it on patient-specific functional scales as well.
Yeah, and I think if you watch the evaluation session that we did, you'll see Dr. Gamboa ask me to do very specific functional activities that gave her, details on what I could functionally perform. And then, of course, she compared those to age-related norms. So I think, again, thinking through how are you going to do this and what's appropriate. I will say that, I was given direction to palpate my own, trigger points and give feedback. So yeah, if you watch that session, you'll see her give me very specific direction on, put your hands here, feel this, tell me what you're feeling, kind of thing. Obviously, you document that you were directing the patient was performing that themselves, and you give the patient that information at the first of the session that, there are limitations. This doesn't replace our hands-on, kinds of things. So you tell them up front that there are some things that we cannot do via this mode.
Thank you. Going on to the next question. For your evaluation of the neck, and I hope I'm saying this correctly because I am not a PT for those of you who are out there, they said they are not able to use a goniometer?
A goniometer?
Thank you. Did you document in percent ROM, i.e. 25%, 50%, 70%, 100%?
So if I use the SFMA as my primary test retest, because the scoring system is dichotomous, or I shouldn't say dichotomous, but it is very classification based, and so the inter and intra rate of reliability of that is pretty high. And then I did use range of motion estimates using exactly that percentage, an estimated percentage of pure rotation. And the way again, if as you see in the video, I had Dr. Leonard turn sideways to the screen and then rotate towards the screen so that I could assess the amount of range that she had relative to her shoulder position. And that's how I named it.
Wonderful, thank you. And thank you for helping me with my pronunciation. We've answered this one in a slightly different format, but I just want to ask it again because I do have it showing up periodically in the question board on both the chat and the Q&A, but just reiterating. So I'm totally new to telehealth. I'm in Illinois, moving into private practice. Where can I find the information as to what CMS reimburses for telehealth therapy visits? What is CMS reimbursing for these visits?
So currently, as it stands today, check again tomorrow, CMS does not cover true telehealth for PT, OT, and speech language pathologists. So as it stands today, if you were doing true telehealth, audio, visual interaction with the patient, treating them like the sessions that Dr. Gamboa and I show you, that is a non-covered service. It's not covered by Medicare. And so we are hopeful that that will change in the next few days. But as it stands today, therapists are not on the list of approved providers to provide telehealth services to Medicare beneficiaries. What Medicare is covering for therapists right now, as of today, are e-visits, phone visits, and what they call virtual sessions. And those are in that e-visit module that's online. And the APTA has a really good frequently asked question document on the APTA telehealth page regarding e-visits and the details of e-visits. So I would encourage you to look at those documents, read through those. But as it stands right now, Medicare, traditional Medicare, does not cover telehealth at the moment.
Perfect. And actually, I'm going to paraphrase a couple of questions and combine them all together. So hopefully that works for everyone listening. But Robbie, what do you think is the holdup with telehealth and CMS? And do you know what the APTA is doing about it?
So I do know what the APTA is doing about it. What the holdup is, man, I would be rich if I could read CMS's mind. But so the APTA is in every avenue possible addressing this with CMS, with the Health and Human Services. They have on their website a place where you as therapists can go and do advocacy with both CMS and with your congressmen and women. And so it's a multi-pronged approach, both from an advocacy perspective and a direct communication perspective. To be honest with you, I have no clue what their holdup is, other than the fact that they do have their hands full. So, you know, our world is revolving around therapy. And so, but obviously, you know, they've got a full gamut of things going on as it relates to the COVID-19 pandemic. That's just a guess on my part. I have no idea. So I can't tell you what's in their brain, but I will tell you that your professional association is all over it and working night and day to try to get that changed.
And then along those lines, we have a question that was very specific to an outpatient clinic in Washington. And they were talking again about how telehealth is not covered by Medicare. And they've been trying to advocate by writing, you know, the Congress, congressweb.com/NARA. They've done a couple different things talking to their local representatives. Are there anything else that you think that people should be doing to advocate for PT health to be covered by Medicare?
Yeah, have your patients calling and advocating, because your congressional folks not only need to hear from the therapist, but they need to hear from the beneficiaries that this is impacting. So I think one of the critical pieces is to have your patients advocating for this service to be covered.
Thank you very much. Okay. We have a handful more questions. We do have about 9 minutes left, and I do want to let everybody know that if we don't get to your question today, we will be keeping all of the questions from the session, and we'll be answering them via email. So please don't worry about that. But moving on to the next question. This one is from Florida, private practice. And I hope I'm saying this correctly again. HIPSO requires that in telehealth, a PT practice within the state in which they are licensed, and they use a HIPAA compliant form. As I understand, Zoom is not HIPAA compliant. Is this a liability insurance carrier specific issue, or is there a way of being HIPAA compliant within Zoom?
So HPSO is a typical liability carrier for therapists. And so if your liability coverage states that you have to use a HIPAA compliant platform to be covered for liability, then that would be a liability insurance issue. Zoom does have there is a medical version of Zoom that is available, and it is HIPAA compliant. There are thousands of other platforms out there that are low cost or free, like Doxy.me, I believe is free. For providers, it's HIPAA compliant. So if your state or your liability insurance requires you to use that platform that's HIPAA compliant, there are options for you that are not super expensive. I will say that, you know, President Trump, as part of this emergency declaration, did remove the HIPAA compliant piece for telehealth for this emergency period of time. So it's only for the short time frame. In light of that, I would call my liability carrier to find out if they are waiving that for liability insurance, since it's been waived at the federal level.
Thank you, Robbie. Going on to the next question. Can telehealth be used in an SNF setting, home health outpatient?
So like, can it, or is it paid for? That's two different questions. So we'll address the can it, and then the paid for is another.
We don't know, right?
We don't know. This methodology of providing care is not new and has been used in inpatient settings and outpatient settings for years. So absolutely, can it? Yes. Are you going to pay for that? That's the $30 million question. And I don't have an answer to that.
Perfect. We have time for just about 2 more questions. So I understand e-visit and phone visit terminology. Could you please clarify between telehealth and virtual visits? I still don't quite understand that. Outpatient PT, the suburbs of South Atlanta, Georgia.
So a virtual visit, let's see. Go to the next, I'm gonna see if I can find that graph that I had. So go to the next question for Jen and let me see if I can find that graph. Cheryl, do you have a question for Jen that we can answer while I'm finding that?
Sorry, I was on mute. And we do have a question that actually is both really for you and Jen. And and it really is, and I only ask this because I know that Jen specifically asked this question the other day. If you have a patient that's in a different state, can you treat them? So I know, Jen, that Robbie had given you the answer for that. If you want to start.
Dr. Gamboa is muted. Can you unmute her?
Again, there you go.
There we are. Sorry. Yes, so you definitely have to pay attention to your Practice Act, and you know, if you're licensed in that state, the state that the patient is in, then you absolutely can see them. If you are not licensed in that state, then you can go to the compact, the PT compact, and if there is, if the other state is participating in the PT compact, then you can certainly request privileges via that mechanism. Otherwise, you cannot see somebody in another state. So we, for example, our clinic had an initial evaluation today or yesterday. No, sorry, tomorrow. I don't know what's wrong with my time frames. Tomorrow, with a patient in North Carolina. So Virginia participates in the compact, as does North Carolina, and so our PT is, who'll be doing the evaluation, is requesting privileges via the compact in North Carolina.
So the general rule of thumb is you should be licensed in the state where the patient is located.
Perfect. And Robbie, did you have the answer to your question, or should I ask Dr. Gamboa a different question?
I have an answer if you'll let me share my screen.
Give me 2 seconds here. Okay, you should be able to share your screen.
Okay, are you guys seeing this?
We are.
All right, awesome. So Medicare telehealth, not covered right now. Virtual check-in, if you see this definition, is a brief check-in with your practitioner via telephone or another telecommunications device to decide whether an office visit or other service is needed. Or it's a remote evaluation of recorded video or images submitted by an established patient. So let's say that the patient sent you a video via your secure portal that you took a look at, and you picked up the phone, you called them, you had a discussion about that. That could be a virtual visit. And then your e-visit is your communication to your patient through the online patient portal. And then your telephone visit is a visit on the phone.
Wonderful. Thank you, Robbie. So one of the last questions we have just a handful left. So for the visit to be valid and reimbursable, does it matter if the caregiver present family is communicating for the adult patient? Given the case the patient needed some assist or cues, or basically the caregiver communicates better and is also very aware of the patient's status.
I'm sorry, what's the question?
I think that they're looking to find out from a reimbursement perspective, does it matter if the caregiver is present and the family is doing the communicating for the adult who needs assistance?
I don't see that being a reimbursement issue. That's certainly a consent issue. So, you know, when you establish this visit and the patient has that person there, you know, you want to make sure you get permission for that person to be there during the session and to provide help, and that, you know, permission is recorded and documented. But I don't see that as a reimbursement issue. Just like, I mean, if I had a family member in the clinic and they were assisting me in communicating with the patient, you know, it would be the same scenario.
Perfect, thank you. And so one of the one of the things we've had a lot of questions come up about, and we have one question after this, but I just want to let everyone know, is we had a lot of pediatric questions come up. We do have one of our other faculty members on the line with us. Her name is Jonah Elliott. She did post in the Q&A a session that she'll be hosting that is specific for pediatric therapists. She's going to be having a webinar on Wednesday, April 21st. And that is sponsored by the VPTA, and again, excuse me if I get this wrong, PSIG. We are also going to be hosting a webinar the last week of April with Ms. Joan Elliott, and we'll be putting this information on our social channels. So for those of you who are pediatric therapists, please watch our channels and you'll be getting some additional information specific to that. The last question is really, I think, geared to both of you. It's a little bit different, but what advice do you have to PTs who are entering the telehealth and are a little bit unsure of themselves and how to proceed?
Go
I
ahead,
think
Dr.
we answered that question earlier, and I would still maintain that you plan your session out, that you standardize your approach, that you get really you determine ahead of time what categories of things you're going to test, and then what test you're going to use to gather your data, and then you practice. You just practice. But as the rest of my staff has said, just dive in and do it. You know, don't just after you get the first one or two under your belt, it'll feel like old hat, and it'll feel quite familiar.
Don't be scared.
Don't be scared. That's right. Jump in and swim.
I do think that's a very important piece of advice there. Don't be scared. We hear that same advice from Dr. Tim Miller specific to teaching online. So I've heard that one quite a bit. Just go for it, relax, everything will work out.
And I think
On your screen,
one of the most important things in the session, and Dr. Gamboa is so good at this, but be confident, smile, put your patient at ease, you know, enjoy the moment, be with them in the moment. Don't be so, you know, you'll actually see her get close to the camera, make faces, make noises, help me do a movement.
I'm helping. I was helping.
Exactly, just like you would in a clinic. So if you're confident and you're assured and you're interacting with your patient, before long you'll forget, you know, you've got a camera in the middle of it. So.
and then we do have one last question that's squeaked in the end, and I feel like it'd just be easy to answer. But is insurance covering telehealth for liability risk?
I don't know what that means. I don't know what that question is.
Liability insurance?
Let me go ahead and unmute the attendee, and maybe she can go ahead, since it's our last question, and ask that one really quickly. Julie, I'm going to go ahead and unmute you and allow you to talk. So if you could answer me, rephrase the question a little bit more, that would be great. Or I'm trying to unmute you, Julie.
There she goes.
There you go.
Yeah, just wondering if there are risks with PTs, especially if you are assessing patients and somebody falls, you know, that could be, we could be sued for that if they complain about it.
Oh, so yes.
Yeah.
That makes sense. So what you're going to want to do, and I outline all these steps in the webinar. You want to get your policies and procedures. You want to have your emergency procedures. You want to have a consent specific to telehealth where you tell the patient what the risks are and the risks that they're accepting. If they're a fall risk, then you would not treat them without somebody standing there with them, just like you wouldn't treat them in the clinic without hanging on to them. So you would outline all your emergency procedures before you start doing this. And you'll see Dr. Gamboa ask me my phone number, ask me my address, ask me for my emergency contact. Was that person in the home with me? Making sure she has all the information in front of her to deal with an emergency. Were I to fall and hit my head, she could call 911 and direct them to me. And then she had a specific consent form, and then she told me the risk. You know, she might not be able to see things. She wouldn't be able to hang on to me. We might lose a connection. All of those pieces and parts. So you outline that in your processes. You outline that in your policy and procedures. You standardize that with all your therapists, and you make that your standard procedure, you know, we could be sued for anything. And so you again, you document all your procedures, you follow all your procedures, you check with your liability insurance, you check your state practice acts, and you inform the patient of the risk. Anything else, Dr. Gamboa?
No, that's it. I'm with you 100%.
Perfect. Well, we've gone a couple minutes over with our session, and I want to be respectful of everyone's times. Oddly enough, even though we're all at home, it seems like we're actually even busier. Not sure how that worked out, but it did. On your screen right now, you should be able to see both the link again to the Educational On-Demand series. If you haven't had a chance to watch all of those, I highly recommend it. Included within that session are 3 sessions where they actually do a full-length evaluation as well as 2 follow-up sessions. They're very educational. And then also, if you have any additional questions that you think of that we haven't answered today, please feel free to email us at social@rehabessentials.com, and we'll do our best to get back to you as soon as possible. Thank everyone again for joining us. We appreciate it. Dr. Gamboa, Dr. Leonard, thank you very much for your information as well. Everyone have a wonderful day and stay safe.
Good luck, everyone.
Bye.
Take care.